Good morning, everyone. My name is Stephanie Kelly, and I am the Executive Director for the Samaritans on Cape Cod and the Islands. Our organization has been answering calls to our crisis line since 1977, and as many of you know, in July of 2022, our center became a part of the 988 Suicide and Crisis Lifeline network. To give a little context and history to this, before joining 988, we had a staff of 5 and a volunteer pool of 40 that made it possible for us to operate our center from 8 a.m. to 10:30 p.m. 7 days a week. When we joined 988, we adapted our model to include hiring about 40 crisis line associates, and we were able to return to the 24/7, 365 model. Let that sink in for just a minute. We went from a staff of 5 to a staff of over 50 in less than 2 years. To further spotlight the growth that's happened within the organization, during the first 2 months of 2024, our crisis line associates answered over 20,000 calls to our local 988 lines. When I came to the Samaritans 13 years ago, we answered approximately 20,000 calls per year. In addition to staffing, there were so many areas where we needed to kind of learn how to be an organization of this size. We needed to create or expand our infrastructure to support operations. We had to build our HR department, create fiscal policies, training, standards and policies around quality assurance and evaluation, to name only a few. But we know one thing, that 988 is working. The numbers I just mentioned are a good indicator of that. We know that individuals who reside in Plymouth, Barnstable, Dukes, and Nantucket counties, which is our service area, are getting support in communities that are often underserved due to our rural nature and our geography. We know that approximately 98% of the calls to our crisis lines do not need to leave our center. In other words, by listening, providing support, and connecting to other resources, our crisis line associates are able to de-escalate the caller's crisis to a level that feels manageable to them. Thus, the burden on emergency rooms and first responders is lessened, which results in a cost-effective way to provide intervention and also reduces healthcare spending. This enormous growth could not have been possible without the support of our partners in the Massachusetts legislature, and your support is still very much needed as we move forward to ensure our ability to meet the ever-increasing needs of those who are experiencing suicidal ideation or a behavioral health crisis. Thank you so much for your time and attention and for supporting the work of 988 and the Samaritans on Cape Cod and the Islands.